Okay, I see it up there. Hello, welcome to Coming Out with Cannabis with your host, Christina DiArcangelo Pooler and Wayne Kelly. Today, we're talking with Neeraj, our CTO at AI Health Outcomes. We had a conversation with you earlier, Neeraj, but we're coming back around and, you're going to keep us up to date with what's going on and keeping us under control. But first, CDP!
Welcome everyone. We keep getting new viewers on our show, which makes us very happy because it's really important, for us to be able to share all the wonderful things and the people that we have on our show from an educational standpoint. And I'm so excited to have Neeraj on today because there's so much going on with our company. And I think it's great for people to see the leadership team behind the CannaBot, the DrBot, AIHO, and its umbrella. So thank you for joining us today. It's late over there in India for you, Neeraj. So we appreciate it. And he even buttoned down his little shirt and put his nice shirt on. His hair's all done. So we appreciate that you're on today, Neeraj.
Sure.
Tell Bruce to turn off his phone.
Yeah, no, that was mine. That wasn't Bruce. I'm shutting mine off. I apologize. But Neeraj, I appreciate, you're out hairdoing me today, and it's very late over there. It's looking sharp, as Christina mentioned, man. Looking nice, and I don't know why she does that to me too. Oh, look at your little shirt. Like I'm a 12-year-old wearing a little button down. Oh, look at that nice little shirt. Yeah.
It's because I have a 6-year-old, and it's like when I talk about going to bed, you guys know, I'll say, oh, even I've said it to you on the phone, Neeraj. Okay, have a good night. And it's just, Chris is 6 now, but he's a little guy. And so it's funny how, people who've known me before I had my kid to, now, like how different, things are, like vocabulary wise. So Neeraj, tell us what's going on since the last time we talked. So we have a lot going on.
Sure. So yes, there are a few very exciting updates to share. Since last we spoke, we have been working on building content for the CannaBot, and we had been with Google and Alexa to publish the CannaBot, and I'm very happy to say that we have been approved to publish. So I think both of these will be available on Google and Alexa as their skill and Google Action in the month of July. So we are continuing to build the content, and by the time that these two bots are available for everyone on Alexa and Google, we will have built all the content that we want to build in the first release. So that's the great news. Finally, we have been approved, and both of those things on Google and Alexa will be out by July.
That's huge news.
Fantastic, because the development team under your leadership has been working tirelessly on this since last year, guys. I mean, to all of our viewers, that's what Neeraj and his team have been working on, besides all the other things that we're doing with the CannaBot and the DrBot and our, technology company in general. It was a lot of work for you guys to get this done, and it's so exciting because now it's ready to go, especially since we had even our traditional bot published on Alexa, which is the DrBot. So this is exciting for us.
Yeah, absolutely.
I think it's huge news, honestly, because how I feel about data and the content, educating patients, as soon as this is available, our content can help or start serving the population, so that's the exciting thing for me.
Yeah, I look forward to, as I lean in, I look forward to really starting to develop bots for specific indications. So for the viewers out there, when I say that, I mean, mental health, to help patients that have mental health issues, right? Being able to have a bot that they can talk to, or the autism bot, or the veteran bot, right? For the veterans who are suffering from a multitude of things that are wrong with them due to the fact that they were out servicing our country, I'm just really excited to be able to really put everything that we've been talking into practice now, and really truly help patients. I mean, even the the patients that have had access to our bot so far from testing purposes and some of the things we've been doing offline from a study perspective, everybody is really happy with the bot. So, you know, and he's so cute, the CannaBot.
I said here,
I think
Bruce, of course. I'll go ahead.
You know, it's a new way of doing things, you know, that's coming up, and the technology, the way it is evolving, it's great. You know, we want to be at the forefront of it, and I think the way we are going about, I think the users, you know, patients with specific conditions and users in general will be very happy to use the way we are building the content, and obviously we'll keep the contents up to date or creative in a way that it's always useful. It's always nice to go to this bot that they can go to. Otherwise, they have to refer to documents, or there are some things that they can never get access to. You know, we're trying to make you know, things go straight to their hands. It's right there that they can access and get all the information they want.
Right, and because there's so much bad information out there, right? You know, if you Google certain things, you'll read stuff like, I read an article, I think it was last week, where someone said there was a certain type of cancer, I think it may have been lung cancer, that medical cannabis can help, you know, and it was like as if the FDA was making some kind of approval, and and when you read the article, it was clearly not that. But when you read the title initially, because that's what made me raise my eyebrow, right? I'm like, wait a minute, how did I miss this, right? Because we're paying attention to everything that's going on in this industry, from, you know, medical to recreational to what's the FDA is doing. And so when I read further in the article, I realized it was just a bullshit. Oops. Uh-oh, Bruce. It was not a true article. And here, if I was a patient and I had cancer and I saw that, I would have thought, oh my gosh, this can help me. Look at this. And with the CannaBot, we do not allow false information in the technology. Everything is backed and supported and substantiated, which is really important, I think, for patients to understand, right?
Exactly. Building, we're making sure that everything is accurate, and you know, the reliability of any intelligent tool is only if you can back it up. So you know, I think, yeah, it's going to be like one place where the truth is available, one source of truth. And you know, not only that it's just there and you can access it, but you can reach out. It's right there with you.
Hey, that's a good segue into another topic that we are, or at least a exercise that we're doing. We are about to send an email to, you know, all the dispensaries to ask them for their information so that we can add it to this database. So if you are viewing this video and you are a dispensary owner, a MMJ physician, you may be hearing from us, and we're not trying to sell you something. We're just trying to get your information to include into this database so that we can serve the patient population together. So look for that email. I think that was a good segue, talking about the correct information in our AI bot, and that's how we're going to get the information from, you know, from our viewers or listeners. So and, you know, as far as we're concerned, you know, the three of us, AI health outcomes, that is the most important thing. Correct data, you know, clinical research, you know, to provide that information to the patients, to the doctors, to the community.
And actually, that brings up a good point, right? With our relationship with Compassionate Certification Centers. We just had Melanie Kachi on not too long ago. I know Neeraj watched that episode because of our partnership with CCC. You know, we work extensively with the entire, you know, clinical team and a lot of the physicians there, as well as Mel and Dr. Donner. So we're going to be doing a rather large study as far as checking in with the patients. It's been a year now that the Pennsylvania patients have participated in the program, and we want to ascertain how the patients are feeling about their participation in the program. So not only from the medical cannabis physician standpoint, their opinions, but the indications that are falling under the qualifying conditions, down to the dispensary questions that we have to the staff, product availability, which then kind of pushes into the grower space. So it's a pretty comprehensive survey. And you guys already have started receiving some of the emails to start pushing into the CCC CannaBot. And I think we're looking at probably in about a week or so kicking this survey study out, right?
Yeah.
Absolutely. In fact, today, wanted to make sure I wasn't on mute, because I do that often, because Bruce is making all kinds of noise. When you said the BS, his steam is coming from his ears. And in fact, he's saying he wants a Bruce bot. We're not going to do a Bruce bot. Since Neeraj is on, he's asking for a Bruce bot. He's saying no, all right? You never know with this guy. But anyway, no Bruce bot, but and no more BS, because he'll sling something at me. But, the idea of this CCC study and 25,000 email addresses is who we're approaching, these 25,000 patients in Pennsylvania, to determine, how has the first year of the medical marijuana program been in this state. I think it's going to be a great study, a great opportunity to flex the CCC bot, the muscles of the CannaBot, and collect some substantial data. It's going to be amazing.
And the white paper afterwards, you guys know, that's one of my favorite things, is to be able to take the data, analyze it, which we're easily able to do in the CannaBot. We can see everything, once people answer those questions for us. And the fact that there's reminder settings so that we can get the patients to remember if they couldn't do it, one day the bot will come on and remind them, and then they can do it, at their leisure, which I think is fantastic, because when you're using, I know a lot of people like to use SurveyMonkey and things like that, right? To be able to capture their data. And they're like, oh, well, it dumps into Excel, and yes, I use it that way. Well, go ahead and use that. But when it dumps out of there and into Excel, it's not validated anymore, right? So from an audit standpoint, whatever you dumped in Excel, anybody could go in there and manipulate the data. With us, with the CannaBot, when we report out from a metric standpoint or finding standpoint, whatever the report is that Neeraj and his team has developed, it's a validated report because it's out of the data that we've acquired through the bot, whatever bot it is, whether it's Doctor or Canna, which I think is huge, right, for people to understand. So people think, oh, we'll just do this survey. But if you're really trying to support your data, the first person, especially healthcare people like us and biotech people, we're going to wonder where the source is, right? And you're going to have to say it was SurveyMonkey. And then, we're going to be like, SurveyMonkey. I mean, for all we know, it could say that there's a pink panda bear in Neeraj's backyard. Okay. And then, okay, there's a pink panda bear. You know what I'm saying? So I think it's important for the viewers to understand that. And for some of the professionals who think, oh, well, SurveyMonkey's so cheap, I can spend $500 or $200 or whatever for my subscription, but it's not validated. It's not validated. So it's like, well, you just wasted all that, because if you really want to take that data and do something with it, how do you validate it? It's junk data, So do it the right way the first time. That's all.
Exactly. And I think the SurveyMonkey, not picking on that one tool, but those are really yesterday's technology.
Right.
You go to a site and fill question answers, and you do it at your own way. There is no way it can be validated. Okay, there is absolutely no way it can be validated. So you want to come up with latest technology. So the way we are doing is it makes sure that the responses have come from the patients. Not only that, but if you just send a link to a patient and keep emailing them that, hey, fill in this survey, you don't get compliance. So here we have an intelligent interactive tool that interacts with the patients, reminds them of filling it out, talks to them in a way that you like to fill it. This is AI, this is 21st century. So it increases compliance, and then you bring AI on top of the responses. So not only that you get validated, authentic responses, but if you have 25,000 responses, it's difficult to analyze them. So we put AI on top of them, so you can view all the responses, drill down deep into them, create some beautiful understanding out of it, make sense out of it, and get the insights that you want out of all this population of responses that you get. So that is really what we are trying to do. Take this process that is outdated, that is yesterday, into tomorrow, and making it so user friendly and interactive that people want to do it.
Right. And imagine the data, that our clients are able to see that can help them maneuver their business into a certain segue, or make them think about something in a different way based on the data they're receiving. So that's a wonderful ROI for them. Not only that, but they are supporting their patients, which is huge. The patients need to feel supportive out there. I mean, especially in the cannabis sector, where it's all brand new, and Cali's been doing it since 1996 with medical, but it's still very, very new to the patients, and they feel like there's a lack of support because there's not enough information available to them. So if a subscriber provides this to them as an option for free to them, because that's what we have mandated as a company, that the patients don't pay, this is a wonderful support tool for the patients to utilize.
The exciting thing, as Neeraj mentioned, is, today's technology, in the old days, and I think we mentioned this the last episode, it was clipboard, paper, pen, telephone, and I'm not going to let too much of the cat out of the bag, Neeraj, as far as what you guys have been working on in facial expression recognition and that kind of stuff, for those types of responses, because, viewers and listeners, there's some really, really cool stuff that we're working on. But, using today's technology, it's actually, from the patient's lips to the real-time report, no more interacting with a pen or paper, they can speak answers, and we receive reports in real time, crazy demographic, the types of reports, these types of presidents and VPs want to see in their boardrooms, but they see it immediately. And there's no, I was tying my tongue there for a second, trying to get a word in, but I had my finger up because I was reminded of two quotes. And the first thing that I used to always like to say when I was working as a first tier support person is when you remove the margin, when you remove the person or the human interaction, you remove the margin for error. So as far as data is concerned, from point A to point B, we have removed human interaction. So there is no margin for error when you're receiving content or the data point from the patient's voice and it goes directly to the report. There's not a whole lot of margin for error in that information. So that is huge, I believe, as far as what we're providing or what CannaBot provides to our client. And number two, of course, and I say it all the time, and it comes from, I actually wrote William Edward Deming's name down because I always forget his name. Without data, you're just another person with an opinion. So that's the actual quote from William Edward Deming that I always butcher. So I just wanted to mention that.
Well, I think that's a good segue to something that we talked about in our team meeting earlier this morning, where Neeraj's hair wasn't ready yet. But we had our team meeting, and we were talking about the latest FDA hearings that were on Friday in DC. Yep. And I know that some of our viewers that follow us on social media saw things come up on Sunday and again today about this, because this is a big topic. And I think before I get into it, I think that what was really important about us as a senior leadership team in the AIHO and the CannaBot and the DrBot is that we had the forethought to develop the technology infrastructure in the manner that we did proactively, especially in the cannabis industry, so that we could essentially be ready for the FDA, because the FDA is very specific about data requirements and the fact that when you're trying to progress a clinical study or a product forward, you have to do research.
That's
and
right.
so I think what's really cool about and what we've done as a team was that we knew that was going to come to the table, and we were preparing for it with the tech side of the company, and then the sister company, Affinity Bio Partners, who can run the research studies. So everything is very synergistic, I think, between the organizations. But it was because of our understanding of what we felt, as if we had a crystal ball there, that the FDA was going to come back and say. And that's exactly what happened on Friday. They said, 1, we want more research. 2, these products that are out there that people don't know where they came from, they're white labeling, they're bringing things in from outside the country, pretending that it was grown in, Arizona or wherever, and the patients don't know what the product really is. The fact that the testing is not consistent, right? And so if you guys remember, we had focus on Leslie Egelking a few episodes back, and that's what her company does, right? She makes sure that what's in those bottles really is that product in it, that it was certified. And was one of the things that the FDA is not happy about, is the fact that sometimes a product will say that it contains a certain milligram of active cannabidiol, and in fact, when it was tested, it did not. And so obviously that's not our portion, of the pie, but our portion is supporting the infrastructure of the industry to be able to substantiate through data what's going on. So we're able to collect the data, we're able to get the data directly from the patients. And not only that, but the sites that are actually doing the research, instead of typing on their computer, there's a way for them to work within our technology now. And so I think that this is really important, that people who thought they were going to get rich off of this industry and they're just jumping in and jumping in and jumping in, and now they're getting their hands slapped because they're making false claims, anecdotal evidence. They bring these moms and dads in and they say, oh, look, this works. Well, yeah, it did. It so you think it did, right? The kid's feeling better. However, there's no data to support it, and there's no dosing. So in other words, patients don't know what to take. And with all of this and all the research that should happen, we're in a very good position to be able to support all of these companies that are looking really to push their product forward for FDA approval.
I agree. It's exciting times. And I sit here and I look at our team, and I think we are perfectly poised, and I believe, as far as technology, and I see the three of us, and it's very evident as to what we bring to the table. You with your background in bio, clinical, and I, Neeraj, of course, tech, and I'm, the nerd. I'm the data guy, I guess, or the geek, whatever you want to call them these days. I've been called worse, but I think we are ready, and just like our pre-conversation, man, I mean, we have a lot of really good things going on. We didn't even talk about all the different bots that we're creating for all the clinical research projects we have coming up, and how amazing that data is going to be, just to receive, those just simple observational pain study, research data using our bot at, several different locations. We're not going to go into it specifically, but exciting research projects.
Yeah, and we were talking about the American Society of Cannabis Medicine that we work with all the time, because I'm part of their infrastructure now on their board, and we're going to have 2 of the heads come on our next coming out with cannabis episode, and Neeraj works with these guys alongside us as we're trying to move things forward in the right manner. And I think that it's just so awesome. I can't wait till we can start releasing some of these things we've been working on in the background, that we can't talk about yet, but we're close, to talking about. And it's just so exciting. Like, hopefully the viewers see how excited we are, because we're really going to be able to help patients, and we're really, really, really going to be able to see what's going on from a data perspective.
Mm-hmm. That's the exciting thing, but hey, guys, Alexa did remind me a few minutes ago we should wrap it up. Should we, Neeraj, do you have anything else exciting to share? I know it's very late over there. Appreciate you coming out for us today, and staying up a little later. and putting on a dress shirt, because that's not what you wear to bed. But anything else you would like to share, my friend? Real quick, we're redesigning the
Oh,
CannaBot.ai
yeah.
webpage.
Yes.
Your team just, tickled the keys with that for a little bit. And
Yes.
so that'll be coming out. We'll push that along. And, so keep an eye for those updates as we continue to make that a living, breathing medium for our little
Information.
venture. Yeah, information here. So, CDP, you want to take us out of here?
All right, it was my pleasure. Thank you so much, Neeraj, for being on with us today. It's always such a great time talking. I think as a team, it's just so nice for us all to come together. I mean, even though you're in a different country, you're in India and we're here, I never feel like we're not together. Like, I feel like our team is very, very cohesive. We may have differences of opinions at times, but that's just the way the cookie crumbles, right? And we move things along in a very progressive, quick pace. We're on top of it all the time, and I think it's just fantastic. So I don't have a hat on today. I would say my hat is off to you, Neeraj, and your team for keeping up with us, and keeping everything afloat. So thank you so much for joining us.
Yeah, and real quick,
Sure.
one of the things I wanted to mention earlier, it took your team 17 times, I believe, to get us approved on Amazon. 17 submissions, folks. That's how hard Neeraj and his team is working. So again, as Christina said, hats off.
On to that point, we were trying to push the limit. So, it was not, I mean, you could publish in probably 2 iterations, but we were trying to push the limit of what they have
Right.
done. And like we discussed, we don't want to talk too much about those things, but we were trying to push the limit, and that's where it took about 17 iterations in Google and Alexa. Yeah.
Well, thank you so much, Christine. I didn't mean to, hone in on the closing statement there, but that's one of the things I remembered, and a lot of hard work.
Yeah, it is a lot of hard work. We work around the clock. I was talking to one of our clients, you guys know who, this morning, and that was one of the things I said to him was that, all of us, our teams, his team, we're also committed to, improving medicine. We can do better. We want to be the champion of change. And so I think that, we're very poised to really set the industry standards the right way from a data standpoint. And I look forward to talking about this at the Women Grow Leadership Summit this Saturday about technology and talking about all the exciting things that we are doing here within our organization. So thank you all.
Fun stuff. Thank you very much, everybody. Thanks, Neeraj. Bye-bye.
Bye-bye.